877-3411.
And thank you to One Time Plumber for sponsoring our KRIM Community Spotlight program. Good morning, Rim Country. Chris Higgins in the studio here at the Sawmill Theater Complex on this beautiful Wednesday morning. Another bright sunny day out there. Hope you can get out and enjoy the weather. A little cool, but oh boy, it is not bad at all. Still sunny. Anyway, this morning we have Banner Payson Medical Center in the studio this morning. CEO Hoyt Scavlin. Good morning, Hoyt.
Good morning, Chris. Thank you for having us.
Oh, you're so welcome. And Keith Gracia, registered nurse at Banner Payson Medical Center. Good morning, Keith.
Good morning, Mr. Higgins. How are you today?
Doing great, thank you. And we're going to be talking about just the different programs, what you do at Banner Payson Medical Center, Keith. And also wanted to recognize veterans. Keith is a Navy veteran, and Hoyt, you wanted to have him come on this morning to recognize him and also other veterans that work at Banner Payson Medical Center.
Yeah, we're very honored to have veterans who work for us, and we want to thank them and you and all the veterans that are listening and those families that support them. Each time when I go to the Longhorn game and they do the Pledge of Allegiance or they sing the national anthem, yeah, to me that flag symbolizes the loss of life and those that have truly given everything so that we can be in such a beautiful place. My wife and I recently traveled out of the country, and when I came back I thought, wow, this country is amazing. I mean, we have high standards and we want to get better, and we should keep holding ourselves accountable. But where we're at today, even with all of our flaws, is an amazing place in order and society, cleanliness, public restrooms that you can rely on, just all those little things. I'm grateful to the veterans and those who actively serve now. I think America is the most unique country in the world, and I know there are other great nations that are our allies and honor freedom of their residents and avoid tyrants, etc. But I'm grateful for those of you that have served our country. We all get the same amount of hours in our life. I mean, let me say it that way. We don't know how many hours we'll have, but it's all limited for all of us. Maybe we can live to be 100. That's my goal. I'm 55% dead. I turned 55 the other day, so I'm hoping I'm being optimistic. But when you give of yourself, and that limited amount of time, there's no greater sacrifice other than giving your life literally. So thank you both of you.
So Keith, thank you, Hoyt. Thank you. Keith, you served in the Navy. Give everyone a little rundown, basically, of your Navy career.
Great. I got the call to serve a few years before 9/11. My goal was to follow my dad's footsteps, who's a registered nurse, but his primary job was a New York City fireman. At the time, you were able to take the tests prior to being 21 years of age, but you had to be 21 to accept the job, so I was 2 years away. So I received the call to serve and joined the military, and then 9/11 happened and heard the second call to serve longer. And I must have upset the right people. I think we went over this last year, because after boot camp in Great Lakes, Illinois in February of '98, which was the worst, I managed to upset the right people, because they sent me to San Diego for 2 years and then subsequently to Hawaii. And the further I went west, the more I saw my parents, so it worked out. And then found the call to nursing after I got out of the military after 10 years. I worked in various jobs as a biomedical engineer, in and out of different hospitals. And I think when the light bulb went on for me is one of my accounts was Sloan Kettering Memorial Cancer Center in New York City. And if you know anything about cancer treatment, it doesn't only affect the person that has the disease, they need somebody to take them to and from their treatment. So you walk into a waiting room where there's 60 folks, 30 patients, and 30 rides that they can't get their treatment. I went home that day and said that I wanted to work with people instead of the machines. So one door closed and a couple of windows opened up, and here I am.
There you go. And how did you find yourself in Payson? What brought you to Payson?
Great question. I cut my teeth as a registered nurse in New York City, and right after round one of COVID, I knew my time in New York City was done. I had moved on and seen too much of the world to know that that's not where I wanted to raise my family. So I knew I wanted Texas, Tennessee, or Arizona first, for the ability to have a multi-state license. It fit along with my personal and my political, my views. And I like the low or zero state tax. I got to Arizona first. Took a travel contract down in the valley and realized that I could only live in the Prescott area, the Payson area, the Tucson area if I wanted to continue to serve the Metro Phoenix area. And I came to Payson on an afternoon and left that day as a resident.
Wow. And now, how long have you been with Banner?
This is my 2-year anniversary this month with Banner, in my 3rd full year.
And you must have been very happy to get Keith.
Keith has one because everyone loves his accent.
That's just
you have to love Keith's accent.
Southern, you mean that Southern accent?
Oh, that's Southern New York
Southern Bible Belt drama.
But Keith's a gem. Each of the nurses we could brag about if they were seated here. But Keith just has a way with people, and hearing your story of why you chose it, you can feel that when you care for people. You just naturally love people. And Keith works nights, and there's only about 30 staff in the entire, less than 30 staff in the entire hospital at night. And so they have to wear more hats and be really tight-knit, and they are, and we're really proud of him and his teammates. And I found it interesting that each of your parents are nurses.
Yes, sir. So what manages the professional licenses in New York State is the Office of the Professions. And if you type in and search for a nursing license without a last name, it's me, my mom, and my dad all in a row. Out of the entire state, there's like 5 Gracias, and me, my mom, and my dad are all in a row. But they're 71 and 72, and they're keeping their licenses active. I don't know for any other reason than to say that they're still nurses, but
that's pretty cool.
Yeah, pretty cool.
I have one question for you, Keith. There might be a listener out there who's in a different career. You were a late nurse,
yes, sir,
compared to many coming out of high school and going straight into nursing. You determined after a 10-year Navy career, and then you said biomed tech, which is pretty impressive. We love our biomed tech. Ruben is our biomed tech at the hospital. He's trained in nearly every piece of equipment, even to triage, and there's a lot of sophisticated clinical equipment that's used in healthcare. So you've made that change. What advice do you have for a listener? Is it too late to be a nurse? You know, what is nursing? What would you say to those that maybe they know of the nurse you hear about, but they really don't know what you do every day? Could you shed some light in case there's a listener out there that might follow your footsteps?
Sure. To start off, it's a great question. For me, I knew that it was always a call to service. I wasn't quite sure what I wanted to do. I knew I needed to be an extension of what my higher power wanted me to do on this earth. And nursing kind of just fell into my lap only because I knew that I still retained that call to serve. I just didn't want to serve zeros and ones anymore. And I had a great opportunity and a great structure growing up. I was both working parents. It's, I guess, the sense of joy in knowing that you're doing for somebody that can't do for themselves. Never too late to be a nurse. I'll be the first advocate for that. I was in my mid-30s when I started nursing school. I think the older nursing student brings a lot to the table that the younger student sometimes didn't have the life experience to bring. It's definitely a challenge because that older nurse also has different life responsibilities that the younger student doesn't have. And I know that I'll probably get some flack with what I'm going to say now. In terms of the physical requirements or what the non-nurse sees a nurse do, I think you can train a monkey to do. It's just a matter of learning how a piece of equipment works. So it's not for everybody because you need the people that can put compassionate hands on people. And that you can teach, but that's, I think, an inherent trait that the nurses that I see in our facility all inherently have.
I think that's a great point. There is a difference. You can be a technician and know what to do, but I think we all have a sixth sense where we can feel genuine, we can feel love, we can feel care. And so to be cared for by someone who is intrinsically interested in my well-being and wants to make it better is going to be a different feeling than someone who's just shearing sheep, moving you from one patient to one patient.
I agree, and I think that's what comes through in the care that's provided, is that genuine, human component. And you can have that component in every single thing where you don't have to put your hands on people, you're putting your hands on their case. It could happen at the DMV, or it can happen at the supermarket. When we rely on the staff to provide that level of hand laying on people, it's at their most critical time is when we have to show up, and that's the real challenge. That's not for everybody, but we have a great team here.
Yeah. And I will be the first to take issue with what you said earlier, because about your comment about a monkey could do it. There's an intelligence level that you have to reach to be able to pass the nurses' boards, and some 12-hour shifts. The industry made that change a number of decades ago, and 12 hours is a long time. And so physically, the nursing that we do, you're standing most of the time, walking. So there's some physical stamina, but there's a lot of math, right? And nowadays, I would say if you can't type, it's harder, because now we don't write with a pen or a pencil, we're typing and using a mouse. So there's some computer skill. It's an essential component to make it efficient for you, the human element. But there is math and science that some just aren't wired for. So
yeah, it's a tough way to, that's why I prefaced it by saying I'm going to take some flack, because I'm not saying that somebody with half the brain, it's very, very challenging.
Yeah.
In a little bit of self-defense, what I primarily meant by that was, if you give me a competent person, I can teach them the required skills. That compassion can also be taught. It is inherently more difficult if you don't already have that inside. And the example that's set with the crew that we have in all various jobs, not just nursing, everybody that puts on a Banner badge, there's a team element involved, and it's a care team, not a care role. So, and that's one of the reasons why this place is gonna keep me, because it's a team effort here.
Nice. So you mentioned you work nights.
Yes, sir.
Now, and what is some of the differences between being, a day shift versus night shift? Maybe some challenges, some things that are different. You mentioned fewer people are on nights, so you're wearing more hats, having to maybe have more roles. So can you talk about that a little bit?
Sure. It's something that translates very easily from what I did in the military. When you are in the Navy, per se, you take everything that you could possibly think you may need and you go away. And when you're away, you wear different hats. You are not just the electronics technician, you're 911 when you have to shore up a wall or a bulkhead or a fire or a flood. Similarly here, during the week or on the weekends, there are certain offices or departments that aren't physically in the building. So minor changes where during the day they may have the ability to knock on the pharmacy's door. In the evening we have to call pharmacy. There may be a role that is now shared between one or two people, whereas during the day or during the week there may be somebody in the building that can fill that role in a specific platform. I wouldn't necessarily say that we do more with less. I just say that when the hours change on the clock, there's just more of a collective effort to get to the 7:30 time in the morning.
Night staff are amazing. The day staff know they're good too, but I think they'll even say to be willing to work nights, it's not a desirable shift for most.
I think the biggest question, I'm sorry for interrupting you, sir, I think the biggest difference would be during the day there's always somebody on the other line to help you and maybe take that critical situation and ease it. At nighttime, oftentimes you are that phone call. So
that's well said.
Makes me think of, you were in the Navy, so ship duty versus shore duty, where when you're out on that ship, that's it. I mean, you're out in the middle of the ocean, and it's not like you can, hey, can you come out here and check on this? But your shore duty or other branches, when they're on the base, it's a little bit different. When you deploy, you're in the middle of somewhere, and then you have to do everything. So.
Great analogy.
Yeah, that's why, you know, it made me think of the short or ship duty. Yeah, that's, yeah, you know, thinking about it being in the Air Force, it's like, wow, that would be crazy being out there, middle of nowhere, and supplies, you need something, being in electronics as well.
Supply is a great example because
Yeah.
most of our departments are closed after 5 or even after 3:30 in the day.
Mhm.
And so in the late day shift and the night shift, we have to, we have very independent individuals that are very responsible. And we pay a little more the industry pays more for weekends and nights because of inconvenience compared to what's going on in the world and what businesses are open. And I've worked early mornings, 3 in the morning when I was in college, but I've never worked where I intentionally stay up past midnight, you know, till 7 a.m.
That's all I know.
Oh,
The
yeah.
city that doesn't sleep, New York City. And if I could piggyback on something that you just mentioned, I just recently watched a film, and it's not a political plug, but there was a quote, and basically the gentleman that quoted it, very famous gentleman, said that somebody that agrees with you 80% of the time disagrees with you 20% of the time. Doesn't make him an 80% friend. It makes that person an 80% friend. It doesn't make him a 20% enemy. So when you are working nights, whether you're in relation to shipboard Navy life or night shift crew in a hospital, you are paying your attention to the positives of what you have. So you're not saying ever, we could have done 20% more if we were on a different shift. We're going to say we're going to maximize the 80% of what we have at night.
That's awesome. You know, the day shift, some of the differences, Chris, that occur is you're interacting with all these other departments that are there, and there's a lot of hustle and bustle can be a distraction, can be a difficult for them. And when I say that, distraction makes it sound like it's not important. It's all important, but
Yeah.
It's time away from the patient. And most of the patient guests and family visit during the day shift, and so there's a little different interactions and more conversations with more people, and so they're all different. And many staff are parents, and so what shift they work can be driven by those constraints. And some actually like working nights as a parent, and just the daycare arrangements become the challenge. That's I just have such respect. 24/7, holidays, there's no day off. The hospital must be open to serve the community, the emergency department, the inpatient unit, all of the ancillary services, taking pictures, imaging, x-ray, laboratory, breathing with respiratory therapy. It's a every day, every minute, 365 days a year, and super proud to be associated with you all doing it.
And now, you were, before the program, I believe you mentioned an award?
Yes.
Or rating that emergency departments received?
Yeah, a couple of celebrations to share with you. On the emergency department side, it's an internal celebration as Banner operates 33 hospitals, and we've been in the top 1, 2, or 3 with our patient satisfaction in the emergency department over the last 2 years. Prior to that, there were years we were in the bottom third of those 33, but we've been in the top 3 for the last 2 years. So we've reclaimed #1, and we have to celebrate it while we're still #1, because the other 2 or 3 hospitals are just excellent too. But we're currently excelling with the highest score in the system, and that's always fun. And we're not perfect, we know that. For listeners that have had family or friends or neighbors or personal folks that, you know, there's gonna be times we disappoint. Sometimes it's really challenging for us not to. If it's timing, I don't wanna be in the ER for 3 hours. Well, on certain days of the year, there's a lot of people in this town, particularly in the summer, and we can be overflowing. And so we know we're not perfect, but on the whole, we are really proud of the collective team that supports the ER, and the physicians, nurse practitioners, the physician assistants, the techs, the nurses, the housekeeping staff, the food service. There's a lot of folks, lab, x-ray, pulmonary, the list goes on, supply, billing, registration. Our patient registration team, interestingly, we have two surveys. There's one for outpatient, which means you're coming for an x-ray, for a lab draw, for something that you come and go within a few hours. And then we have our emergency department patient registration survey. And we've been one or two in the emergency department, and we were pretty pleased. I hope I don't get these reversed, but we had never been number one in the outpatient, and we currently are number one in outpatient of all 33 hospitals. So
Wow.
it's every department that's really, they're just hiring the right people like Keith. It just, you can feel it.
It's everybody. I was just going to piggyback on what Hoyt was saying. If you came and for a cup of coffee during a night shift or day shift, it's not just the nursing crew that are on first name basis. It's everybody. So when I say hello to the person that is in the EVS department, it's a first name basis. It's almost as if the staff that comes to work every single day is colorblind to the scrubs that we're wearing, because there is an embodiment of a one team aspect, and that is what is going to keep me at this place. That's one of the only reasons that would keep somebody like me in a place like that, is because it's at the finest down to the earth level. It's people taking care of people regardless of the color of their scrubs or the title on their badge. We come to work together with our A game because the people we serve are there without their A game. And that, in 11 years of being a nurse, this is the only place that I see that. And the community size and that feel is 100% responsible for that. You buy into where you work because it's more than a job. This is your neighbor.
Well, that's like music to my ears. That's a dream in my career, to have people feel that way. And you can't create that as a leader. You have to hire the right people who create that. And so I'm super, super proud of you and the others. One other celebration that you all have achieved and we've achieved together is the second year in a row we've received the Chartis, CHARTIS. Chartis is a data quality measurement company in healthcare, and so we received the award of a leadership award as a top performer for outcomes, clinical outcomes, and patient satisfaction. So it places us in the top 25% of hospitals in the country, rural hospitals. They divide metropolitan from rural, and then they give awards. So we're 2 years running with that award, which is something that's very unique, we're very proud of. And kind of as a sister award in a way, although they're unrelated from, CMS as a government entity, that we received the 5-star rating, which is really, really challenging to receive, and will be really hard to sustain. My guess is it will be in the 4 to 5-star ratings in the years ahead. And sometimes you slip into a 3-star rating, and 3-star rating is a really good rating. So, yeah. But we're with the right team, and Banner's strength, in my opinion, is the evidence, is the clinical evidence-based practice. So within our electronic health record, there's little alerts and system signs. We try to take the evidence that the world is collecting every day. Healthcare is changing so quickly. Physicians, I don't envy how they have to try to keep up on the science, the discoveries, the improvements. And we adopt that, and so we have good clinical practice and then great people who are exceptional in applying their heart and applying that and create something special. Our nurse retention right now is over 93%, which is pretty amazing.
It's funny because that's what I was going to ask you next, was retention. And it seems like people that come in on the Community Spotlight program, your employees, nurses, doctors, staff, wherever they're working in the hospital, really enjoy working there. And it doesn't sound like they plan on leaving or want to leave anytime soon. So retention, and I know there's a lot of factors that play into that. Things happen in people's lives, circumstances, change, whatever it is. But it really seems like people that are working at Banner Payson Medical Center really love working there, and they want to continue to work there and have no plan on leaving.
That is no more evident than by the fact that there are more than a handful of new employees, and when I say new, within the last year or two, that are coming here and buying homes.
Yeah.
This is not the platform to drop names, but I can at least that many people that have made the decision on an individual or a family basis to make this their home, and that's a huge commitment.
Mm-hmm.
That's awesome. Yeah, our overall staff turnover, I'll use retention. We're retaining over 90% of our staff, and
Wow.
I've never
Wow.
been part of an
Yeah.
organization our size that has been able to achieve that. I've always strove. I wanted to achieve 13% turnover, lower than 13%. Now we're at 9.5%, and it's been sustained. I was curious if it was a nuance of the pandemic that we would see it wear off, but we're finding we'll bring in a traveler. Traveler is a nurse or a clinically trained individual who's helping us out for 12 to 13 weeks typically. And they keep converting to full-time employment. They have a good experience here. They feel what Keith is describing, and they join us.
So for me, Payson sucked me in, and then an opportunity to interview at a hospital around the corner was enough to see, well, this is not only where I would love to live, but to be part of an establishment like I'm a part of now. Huge. Because you never get both at the same time. There's, at some point, invariably there's a trade-off, whether that involves a commute or where you have to decide to create a home with your family because you do now have a commute because you can't afford to live in that immediate area. This is the best of both worlds. It's an opportunity to have what you would have in the valley because it's the compensation package is competitive with the hospitals down in the valley, and the real benefit is that you're in the same organization, but you have that community aspect feel. It's a win-win on all accounts.
Yeah, and I would imagine right now, probably the majority of fields or positions in the medical field are in high demand. So there's opportunities for really anyone in the organization to go somewhere else and get hired right away. So to have that very high retention rate when the field is the way it is, it'd be it was overstaffed, or there were nurses just everywhere and looking for jobs, but that isn't the case.
Such a blessing. Just grateful to be part of, and success breeds success. And I will say, when we recruit physicians, when we recruit nurses or other professionals, the best recruiting is the fellow nurses and the fellow medical staff members. Because give them some time, let them talk freely and openly, and that's a differentiator for us. Now that this has been created, people want to come join it. It almost seems too good to be true.
There's a job on the VA work board right now, and the only reason I know this is because it's a no-brainer for me to find a role in the VA system in a part-time capacity and still be able to do this in a full-time role, which is what my plan is. And I came across a job on the VA board right now that says VA RN nurse recruiter. That's right up my alley. And it would be a job where I would feel if Banner offered me that position now, it would be stealing money because we're doing it already. We're doing it already in a community like this because we can't go to the gas station or the bakery or the movie theater without running into somebody whose life was directly impacted by a member of our staff. And that is what's going to keep people here.
Wow, that's great. Well, it is 10:30, so thank you so much. Thank you, Lloyd.
Thanks. Keith, thank you for joining.
Yeah, for coming on. It's great. And so appreciate everything that you guys do, everyone at Banner Payson Medical Center does for our community, serving our community and taking care of our community members.
It's an honor.
So that is great. Well, thank you everyone for listening and watching this morning. Thank you to One Tom Plumber for sponsoring our Community Spotlight program. Time to get back to the music here on KRIM with some Buffalo Springfield, Fleetwood Mac, ELO, and more. But first, let's get an update from the National Weather Service so they can tell us how beautiful it's going to be in Payson today. You guys have a wonderful day. There we go. All right.